I'm excited for this podcast because you're going to meet Dr. George Everly Jr., who is one of the founding fathers of disaster mental health. This is an absolute expert in the field of crisis intervention. He is a psychologist, a professor at Johns Hopkins. He's had appointments at Harvard. He's worked with the FBI. This is absolutely his field of expertise. And I wanted to bring him on to talk about our reaction to COVID, not only short term, but what are the long-term impacts on mental health, psychological well-being, from being quarantined, from having that level of anxiety, and what are the different ways that we experience it. And so one of the things that we talk about is the recent school shootings, distress, suicide, all of these things that you are seeing now in societies. I think it's a fascinating interview. I wish it was longer. We had a full hour set aside, but unfortunately we had some connectivity issues, so we had to set up a last-minute Zoom call. So it's an abbreviated discussion, but I think the conversation, the content, I think was really interesting. So enjoy, hit the like button, subscribe, all those things. Thank you.
Started in 1976.
Yeah, that's so.
Yeah, I started in public health, and my interest was actually neuroscience. So the part of the brain that I studied, this comes under the heading better to be lucky than good, I guess. The part of the brain I studied ended up playing a pivotal role in the formation of something that would later be diagnosed as post-traumatic stress disorder. I then developed a test when I was actually thinking, I think when I was doing a fellowship. So I finished my public health training and went back to school and studied clinical psychology and behavioral medicine. And either on my internship or my fellowship or something, I developed a test to measure the integrity of the hippocampus. And when I came back to I interned at Johns Hopkins. When I came back to Johns Hopkins as a division chief, we started using that test.
Mm-hmm.
And we had a trauma clinic very similar to what you'd find at Mass General. So we were administering the test to a lot of PTSD patients, and led us to the conclusion, and I think we published the first paper suggesting that the most severe forms of trauma could actually create organic brain damage, which did explain a lot of the symptoms and the recalcitrance that we were seeing. That ultimately led us to new therapies, both pharmacologic and behavioral.
Wow. So when you said integrity of the hippocampus, you mean like physical integrity of the hippocampus?
Yes.
It actually, wow. What is you must be busy the last 2 years. You must be pretty busy with your work in psychological first aid, both from COVID and then with all the school shootings. Do you see a relationship, just in the work that you do you see a relationship between the two? Here's why I ask is, to me, I wonder, when we first had the social distancing and the lockdowns and the concern about COVID, there was research that came out, I think maybe 9 months into the pandemic, that said that there had not been an incidence of suicide. The mental health piece had been sort of de-emphasized at that point, which felt odd to me because it seemed obvious that there's going to be a lasting impact. And then I'm looking at it now and going, it seems like now we're 2 years after, it feels like suicides have gone up. And then there's this, I don't know if it's the media reporting it, but there has just been this massive increase in, gun violence across the nation.
So by way of background, my colleagues, I spend most of my time at the Bloomberg School of Public Health at Johns Hopkins, and my colleagues and I wrote a couple of papers, 2006, 2008, actually predicting this pandemic. So you can imagine all of a sudden we were very popular when it hit.
Yeah.
We did it not based on a crystal ball, and none of us are virologists, but I actually had the opportunity to work in Hong Kong when in the wake of SARS, and then spent time in Singapore with H1N1. So this is actually my third pandemic up close and personal. So it's a unique perspective, and I may be one of the few mental health clinicians to have that perspective.
Yeah.
But we also, at Johns Hopkins, we are also the world's largest repository on data for the 1918 Spanish flu as well. So when we put all of those four together, we were able to, especially the early stages of the pandemic, we were able to plot a trajectory. So I've probably done about 140, 150 presentations since March or April. The most common topics that I'm asked to present on are psychological first aid, which the editors of Scientific American said everybody should take that online course. So what we did is we put a online course on the Coursera platform. It's a free online platform. Yep. It's a free course. It takes 3-4 hours to take. But all of a sudden, the worldwide interest in psychological first aid skyrocketed. So we have about 440,000 people who have taken that class now, making it one of the most popular online courses of all time, actually.
Wow.
So there was great interest in that class and talking about the evidence base for psychological first aid. And we have two randomized controlled trials. But there was also great interest in two other things that we had been working on. One was a model of the psychological trajectory of a disaster and this pandemic. So we took the work of Diane Myers and extended it to the pandemic, and we were able to predict pretty accurately the psychological phases, and some would say very accurately. So people were interested in the model because the model tells you where you've been, where you are, where you're going. And from a public health standpoint, it allows you to more effectively allocate resources, which are limited.
Yeah, what can you describe? What is that? What does that trajectory typically look like?
Well, 7 phases. And it starts with a pre-impact phase, and then the impact. And there are certain behavioral things that you expect, certain actions in the impact. And the impact in the heroic phase, people do truly heroic things. But they're riding a wave of adrenaline, and we know adrenaline will be exhausted with time. Yeah. When the first wave of the pandemic hit, or the disaster is over, a hurricane, a tornado, or something, there's then generally a brief psychological high five honeymoon phase where people are saying, wow, we made it. But the field of disaster mental health was developed not to attend to those phases per se, but the next phase, which is Myers called the disillusionment phase. And this is an inevitable phase where people go into, up to the edge of, or deep into the psychological abyss of disillusionment. How did this happen? Why did this happen? How are we ever going to bounce back from this? So the field of psychological first aid was developed, and the field of disaster mental health was developed to help people bounce back, to steepen the curve, if you will. And then you'll see people go into phases of rebuilding, reconstruction, ultimately recovery. The problem with the pandemic is the more waves we had, the more problematic it became. So one of the other things that we were working on was a model that predicted psychological toxicity. So we had 4 factors that predicted toxicity, which also helped us explain why this pandemic was the greatest psychological problem that we've faced in modern history.
Can I just pause you, because I just want to make sure I'm tracking it. As far as that disillusionment, you're saying there's the disillusionment phase, and then you move to rebuilding. And maybe this is what you're describing by psychological toxicity, but my assumption would be that your psychological foundation, your level of resiliency would impact the length of time that you are in that disillusionment phase? Like your ability to transition from disillusionment to rebuilding, is that influenced by your global stability?
It's influenced by many factors, pre-morbid factors certainly being some of that. But at the community level, it's the level of community resilience. So the four factors are basically the morbidity and lethality, that would be one factor.
Mm-hmm.
The duration, the longer something lasts, the more toxic psychologically. And if it comes in unpredictable phases, that's even more toxic. The degree of uncertainty surrounding its etiology and its trajectory, that's a third factor. So you put those three together and you realize the pandemic was the worst thing we've seen. Arguably, some would say, well, you know, there's World War II and that was terrible. And yes, I'm not going to debate that. And there was 9/11, and I worked in New York for over a year. I understand that. But the fourth factor is what makes the pandemic the most psychologically toxic. Because of all the disasters in modern history, resilience has been high. In pandemic, the resilience has been low. The uncertainty from medical, legal, governmental authorities has been noteworthy, shall we say. Some would argue the whole process was politicized, which was remarkably toxic. It tended to widen the schism politically, not bridge it.
Oh, yeah.
And we know, our research tells us time and time again, the single best predictor of human resilience is connection to other people. That was the lowest of any event since the 1918 influenza. So we are in a unique time in history where we are living through the most psychologically toxic worldwide disaster that we've seen in modern times.
Wow. Yeah. Yeah. I think that last component there, the piece about the interpersonal, how connected we are interpersonally, it is shocking, because in my mind, the way I think about it is that when there's a traumatic event, you naturally gravitate to each other, right? It creates cohesion. But you're right, because of the political environment and the differing views on what happened, we have become more separated than ever.
It's the virtual textbook on how to make resilience and recovery more difficult.
Yeah.
We have Dr. Amy Athey and I have a book coming out in January, and it's called Leading Beyond Crisis. And it's excuse me, it's a book about what leaders need to do at the community level, at the organizational level, at the national level, whatever, to not just help their constituents bounce back, but perhaps even spring forward. So we've been doing some research for about a decade on leadership, on crisis leadership specifically. So we understand the factors that promote crisis leadership. We sit back in utter amazement as we see virtually no good examples. When we were writing the book, we wanted to highlight some case studies, especially governmental and world leaders who were handling things well. And I'm not a political guy, so don't read this as a political statement. Not only did we not find anyone doing it well according to our prescription, we found better case studies on how to do everything as we would indicate it should not be done.
Yeah, the opposite.
So we did highlight in the book the Prime Minister of New Zealand, who handled the pandemic, in our opinion, well. And so we had to go to private industry to find case studies. And they were prime exemplars. So we interviewed extraordinary leaders, international CEOs who did it by the book. And so So we know what to do. We know the factors. Our literature review literally, no hyperbole, went back 2,700 years.
Wow.
So we know what works. What takes my breath away is reflecting on the quote from Santayana: "Those who fail to read history are doomed to repeat it."
Yep.
Um,
Yep.
we have handled this in a manner that is a virtual textbook on what not to do.
Wow. Can we, first of all, I want to read the book. When that comes out, I definitely want to read it. I would love to have you back on to talk about it. Given where we're at now, is there anything we can do to right the ship? How do we correct this?
Well, first of all, you have to pick a problem. You just can't, what part of this needs to be righted?
Well, I'll tell you what I'm thinking about, or what feels the most concerning for me. What feels concerning to me is it seems like there has been the pandemic created this split in our society about how people view this, right? Which has fractured people. But to me, the most damaging piece has been that the have-nots, the people that had the resources, people that were more resilient financially, they had stronger communities, I think that there was a segment of our population that has done okay since. I think there's another segment of our population that for whom this was incredibly damaging, and they are, because they were less resilient to start, have very much struggled to gain traction. And that's why I was asking the question about the school shootings, and the mental health component of this for people that weren't on solid footing initially. And so from my view, it's like, how can we help bolster the people that are struggling most through this?
So the World Health Organization and the United Nations, especially the United Nations in early 2020, wrote a rather brilliant document. And they said there will be three groups of people: those who were challenged behaviorally, psychologically, prior to the pandemic, they will get worse. There were the people who were doing okay. They will be adversely impacted, but they'll bounce back most quickly. And then there are the people actually at highest risk for the pandemic problems, psychologically speaking. And those are first responders, disaster workers, and especially healthcare workers. And that's exactly what we see.
Yeah.
We developed a staff support system for the Johns Hopkins Hospital, and then it was so successful it spread to the entire health system. We included, we have what, for lack of a better term, is a peer support program, where we ask for volunteers from all over the health system, physicians, nurses, security personnel, you name it, we got it. And we train them in psychological first aid. And we have a 24/7 call capability and response capability. Of course, obviously hospitals run 24/7. So we have that. We have the #1 ranked Department of Psychiatry in the country. But contrary to what you would think, the involvement of the Department of Psychiatry is, if you think of a continuum, the last point, not the first point on the continuum of care. We have spiritual care services, we have wellness services, and we integrated them all together. And ultimately, we did a international search of how healthcare facilities were doing, and we had prime exemplars of. We thought, if you want to build a support system, here's a model, and we held out 2, possibly 3. Johns Hopkins, the Hospital Authority of Hong Kong, when they served 43 hospitals, I think. And NYU was doing an excellent job when we were doing our sampling, and we ultimately published this in the Journal of the Academy of Consultation Liaison Psychiatry. So you are correct. The people that were challenged beforehand will be challenged even more because of something like a pandemic. But there is a theme that the research on resilience, again, this to borrow a phrase, this ain't my first rodeo. I've been to 39 countries. I've been doing this for 40 years. And the theme of collaboration, cohesion, compassion, and support is the single best predictor of resilience at the community, at the personal level, at the organizational level. We suffer from an illusion that if we throw money at things, it somehow gets better. This is not true. Just absolutely not true. I had a very unique experience to spend roughly 10 years off and on working in another country that had been devastated, absolutely devastated by war. They had, to borrow a phrase, more money than they needed. And it was a very unique experiment of sorts, naturalistic experiment, where they had all the money they needed. And yet that did not predict, as you would have expected, the recovery of the country. I gave a final address to the parliament of the country when I was leaving, and I said, your country will never fully recover until your people recover. They had rebuilt an infrastructure second to none. Because everything was destroyed, they rebuilt almost from the ground up. And as I said, they had extraordinary financial resources so they could build whatever they wanted. And yet, the country did not recover until its people recovered. And that's where we come in. That's where the art and the science of psychology comes in, especially disaster mental health, which is still a nascent field. You know, if I had to pick a date for the beginning of the field of disaster mental health, it would probably be around 1992, where there was a coalition, a coalescence, I should know. Well, it was a coalition to some degree, but a coalescence of the American Red Cross, the International Critical Incident Stress Foundation, and the International Society for Traumatic Stress Studies. And recognizing that we had to do something, we had to develop new clinical skills, because therapy in the acute wake of a disaster is not your best option.
Right.
So we're still learning.
I really, I'm sorry, I know we're coming up on the end of the hour and I've got to jump off. I really appreciate you talking about this. Can we stay connected? And I would love to have you back on to talk more about this, especially when your book comes out. I'd be happy to read it and we can talk about it on this podcast. It's great. What you're doing is I mean, I know you know this, your work is fascinating and could not be more valuable right now. Like just the sort of sober way of looking at what's happening to society and people, so important.
Well, there's a free, I do a blog for Psychology Today magazine online. 600-800 word blogs, posts, I should say. It's called When Disaster Strikes. And there are several posts on school shootings, school shooters, disasters in general. And again, free open access. So if you want to read more than welcome to take a look.
I will, absolutely. Thank you. Great talking with you.
My pleasure. Thanks for having me.
Bye.